Hi, welcome to CHD 242, the spring 2020 version where we all get to learn in our houses. So, um, from now on, we will do some online lectures like this. And this is this week, week number 4, and we're covering chapters 4 and 5, all about development, which is something that you already know a lot about because you've taken a bunch of classes on child development. So we're going to go through this pretty fast. So, what is normal or typical development? Normal or typical development follows a predictable path, a continuum. So, we know that babies are going to sit up generally before they can walk. We know that preschoolers are going to be able to um, run and jump. We know that older kids are going to be able to have conversations and do math, right? So, beginning in earliest infancy all the way through, we are generally talking about through about third grade in early childhood. Okay. So, like I said, they do them in sequences. There are milestones that children hit, and they do them in an order, and they are generally hitting them at about the same time. When a child is not hitting milestones in, within an appropriate range, that's when we start thinking about, is this a developmental disability or delay? So we know that infants need that interaction between them and caregivers for brain development. We know that they're learning through their movement and their senses. Toddlerhood, we know, starts after walking. Um, and generally, what happens a lot in this time is language development, independence, potty training might start. Preschool, ages 3 to 6, children are developing creativity, lots of language development, physical skills development. They're learning to catch and throw balls, jump, that kind of stuff. And they're also developing social emotional skills. Primary school, a huge focus for this age group is reading ability and more of those independent skills, being able to take care of themselves. So, when a child is at an age level where you would expect certain development and you're not seeing it, that could be a developmental delay or disability. So, when you see a bunch of 2-year-olds and most of them, let's say you have a class of 10 2-year-olds, all of them are walking but one, that's a sign. Like, that kid probably has some sort of developmental delay or disability and needs to be assessed. Okay. Um, it generally is a delay or disability if you see a child who is performing at a level that is much younger than what he really is. So, children who are at risk for developmental delays and disabilities, there are biological risks, birth defects, chromosomal abnormalities, and heart defects can put children's development at risk, as can environmental risks like poverty and child abuse and neglect. Resilient children are the ones who um, might have a developmental risk and they're able to overcome it. So, somebody who is born into a child or a home of extreme poverty, but for whatever reason is able to go beyond it and excel, that's a resilient child. A vulnerable child is one who can't recover, who isn't able to transcend whatever is causing the developmental risk. Now, there are children who have developmental delays and also are gifted. So, a gifted child is someone who has special talents that are beyond what his or her peers' abilities are. So, a lot of times it might be somebody with very advanced language development. They learn quickly, they're curious, they find unusual and creative solutions to things. That's a gifted child. Um, and like I said, you can have developmental disabilities and be gifted. So you could be very gifted with language skills, but have physical delays, right? You could be very gifted physically and have intellectual delays. So it's important that we not just look at what we can see of children, that we observe them for extended periods so that we and really focus on what their abilities are instead of just focusing on what their disabilities are. Because often you'll find children who have um, a lot of ability in one area may have delay in another. So I had a preschooler who was an excellent baseball player. He could throw and catch like nobody's business, but he could not write his name. He was not interested in any academic stuff. And he was delayed intellectually, but he caught up. It worked out. Okay, let's go on to chapter 5, developmental disabilities causes and classifications. So there are biological factors which lead to developmental differences. Genetic disorders, syndromes, that kind of thing. Down syndrome, they got an extra chromosome and it makes a difference. So you've all seen or known children or people with Down syndrome. It's a recognizable look, it's a recognizable personality, and it can be also accompanied with heart and intestinal abnormalities. And that's all just because they got one extra chromosome. Fragile X syndrome is a break on a chromosome in males, and it causes large ears, language delays, autism like behaviors, hyperactivity, and delayed motor development. Metabolic disorders, when a unborn child can't get the metabolize food the way they need to, it can change cells. Okay. And then you have abnormal gene disorders. So this means that your genetic makeup is abnormal for whatever reason. And so Tay Sachs is one, cystic fibrosis is one. Cystic fibrosis used to be one where if you lived to be a young adult, that was about all you could expect. Now it's becoming much easier, not easier, but much more treatable. And people with cystic fibrosis are living longer and longer. Sickle cell anemia, where the red blood cells aren't formed correctly. And then Duchenne muscular dystrophy is when muscles deteriorate, and it's present in males. Then there are prenatal infections and intoxicants. So infections are prenatal things that mothers have that may impact the child. So rubella, CMV, herpes, these are all things that if a mother experiences while she's pregnant, they will affect the unborn child. AIDS, maternal diabetes, preeclampsia, all of those things. And right now, we're all at home because of the coronavirus, and it is a virus that people get. It affects them. We don't know how it will affect unborn children at this point. So it'll be interesting to see what happens with that. A couple of years ago, if you remember, the Zika virus was going around. It was carried by mosquitoes, and women who contracted the Zika virus while they were pregnant tended to have babies who were born either with no brain or with microencephaly, which is very small brains. Other prenatal infections can be, or intoxicants are caused by mothers' behaviors. So alcohol use and drug use can lead to fetal alcohol syndrome and fetal alcohol effect. Poor nutrition can lead to low birth weight, a variety of damages to the brain and nervous system. And then there are birth complications. So things that happen during the birth process, like lack of oxygen to the brain, can cause brain damage. Premature babies can suffer hemorrhaging. So C-sections often are performed when the life of the mother or the infant is in danger. Complications following birth. Meningitis is a virus or bacterial. There's viral meningitis or bacterial meningitis, and that affects the brain, can lead to brain damage. And encephalitis leads to brain damage. Lead poisoning damages the nervous system. So poison from lead in lead-based paint in older homes can cause brain damage and nervous system damage. And then poverty is a developmental risk factor. So, and it's broad ranging. It's not just you're poor, so you don't have quality prenatal care. It could mean that because you are poor, your child doesn't get the appropriate nutrition prenatally, right? And then also, after a child is born, if you don't have access to healthy food, it can cause developmental delays, disabilities. Inadequate healthcare and education, living in poverty, not being able to find prenatal care. It can result in birth complications, right? And then if you can't get regular medical checkups for your newborn. So good care is hard to find when you are living in poverty. Often substandard housing is in areas where there are environmental concerns. So think about like Flint, Michigan, with the lead in the water, right? And then single parent families. Single parent families often are in a lower socioeconomic group and they have more risk factors. It's just harder, right? So those are some causes of developmental differences. And then, of course, childcare. If you don't have quality childcare, your child may not be having those interactions with a caregiver. A baby who's just left in a crib all day isn't going to develop the same way that a child who is having quality interaction with a caregiver. All of these things are disabilities or delays which are eligible for services under the Individuals with Disabilities Education Act. So they would be eligible for early intervention or preschool for at-risk children. So the way this works is you're a child who is assessed and found to have a developmental delay. If it meets a certain threshold, then you can access services like you learned about when you did your early intervention training. So all of these things, speech and language disorders, specific learning disabilities, developmental delays, intellectual disabilities, emotional disturbance, a combination of many disabilities, hearing impairment and deafness, orthopedic impairments. So anything that interferes with walking or other body movements, health impairments, visual impairments, combined deafness and blindness, autism, traumatic brain injury, all of those things make you eligible for Individuals with Disabilities Education Act services, right? Early intervention. But it doesn't mean necessarily if you have one of those things that it's going to meet the threshold that you need to access those services. And it also doesn't mean that you have a language delay so you get this specific service. As you know from the assignment that you did, the priorities of your services, your interventions are based on your family priorities. So that's a little bit about that. That's chapters 4 and 5. I'll see you in chapters 6 and 7.